Thanks.
Thank you. All right. Good evening, everyone. It is Wednesday, May 20th, 6:33. Let's call this Wakefield Board of Health meeting to order. We'll start with public participation. Anyone on for public participation this evening?
I don't have any rate.
Okay.
Just hand.
All right. So 6:33 will close public participation. And then we'll move on to minutes from April 15th. I had a chance to read them. Any additions? If not, I take a motion to approve.
I'll make a motion to approve. Excellent notes.
Yes,
Better than
I
mine,
agree. You
Mr.
did a great job.
Secretary.
I read them as well, so, yeah, second, so.
All in favor of approval of the minutes for the 15th of April?
I'm Macaulay.
Linehan, aye, so moved. And then to discussion about rodenticides. Last time we had sort of talked about getting a little bit more like information.
So yes, we are. So we have some information today. So in your packets, you will have three documents related to this. There is a document titled like a draft policy on the use of second generation anticoagulant rodenticides, SCARs. There is a statement of support draft in the documents, and then there's also a printout of a press briefing that we received from State House regarding a state legislation called Mass Ready Act, otherwise known as Senate Bill 3050. So since we last discussed this, I've had a chance to speak with DPW here in Wakefield. They've spoken to the contractor that they use. They are pretty sure that there are no second generation anticoagulants being used currently on any town property. But they said that they would be making sure with the schools, making sure like, across the board, they would not be using it. I know the board had expressed an interest in something a little more formal. So I took a draft from a neighboring town, the town of Arlington. And they actually have a policy. So I took it and I made a couple of changes just to make some more specifics in there. So this might be a good chance. I know, you guys can have a chance to look at it now, but I'd advise probably like maybe next meeting voting on it, but at least just having a chance to read through and asking any questions. But I'll kind of give you the highlights. So essentially, it would apply to all town-owned buildings, facilities, grounds, parks, fields, cemeteries, open spaces, and public right-of-ways. It would also apply to the town, but also contractors, vendors, consultants, and third parties that the town may use for certain projects. So the current restriction at the state level is that it was that we as a local municipality could not be stricter than the state on rodenticide use on private property. That has since changed since our last meeting, which I'll get to a little bit later. But this regulation specifically addresses SCAR, second generation rodenticides. There's some definitions in here that talks about anticoagulant rodenticides, integrated pest management, just terms that we use frequently. And then it also has a section about waivers. So in the event that we have a public health emergency, that could be if there's a bunch of rodents showing up at a property that we just can't get under control with other means. This gives a carve out for that. But it also has a formal process. So a waiver would have to be requested by the town. The Wakefield Board of Health would have the ability to review and approve this process, waiver requests, and then also we would in this draft regulation, we would also post on the town of Wakefield website within 10 business days, if we were to grant a waiver, including a summary of the justification and duration of the use. And then the rest of it is the administrative portions, so violations, enforcement, severability, all that, effective date. So this is a draft just for town-owned property for second generation anticoagulant rodenticides. I guess I'll stop here, take any questions about this, and then I can move on to the next stuff.
This is great. Thank you. This is kind of what I hoped, just sort of formalize things. I didn't expect the sort of carve out for waivers, but I think it fits if we're having an emergency. And I like that we would sort of almost have like a variance type kind of form.
Basically a built-in variance process, yeah.
That makes sense and I appreciate the board being involved in that.
Sure. So I guess there's there's things that we can do to change this, I guess, in that sense, if you wanted to be if you want to be a little more nimble, you could, I guess, delegate authority to us to review waivers and then grant or not grant. And then should there be any kind of like dispute over whatever decision we make, that could then go to the board and make a final decision if that's what you want to do, or you can just leave it. I'm just trying to think of like, again, I don't know how frequent public health emergency involving rodents would be. But if this is the way it's passed, I assume we'd have to have a board of health meeting in that sense. So
And if it was a public health threat,
it might actually be good anyways for the board to meet
yeah,
if
that's,
there was a health. So,
Yeah, that's, I think what you want.
okay. So we'll leave it. We'll leave it as such then.
Okay. My question is on the violations, okay?
Yes.
Is the health department, Health and Human Services, going to designate someone who's going to go around to the town halls or the town buildings every once in a while and assure or get a report from the DPW that, who's going to actually be the person that's going to be responsible and have to go out? And if there is a violation, how are we going to find it? And when we do find it, who would be issuing it? Would it be us through the health department?
Yeah. So under enforcement, in section 8, it says that the Wakefield Board of Health or its designated agents, which is standard language for us. So you guys would designate us to do the enforcement. We've talked to DPW about this, and they have a pretty good handle on the contractors they use, which they're really the only department that uses them in the schools. So we've asked them to produce reports, and when they put out to bid contracts for rodent control, like they would include this as a requirement for
like permitting.
permitting. And when they do grant like a contract or they do grant a bid, they would include this as a requirement for services. So I mean, we wouldn't necessarily be doing active surveillance, but because these are like, at least this regulation talks about the towns, so we would just work with the DPW on that. And should there be any concerns, we could then look into it. Like, so let's just say there's concern about a black box found outside of Gas and Light, just making that up. But if we could then reach out and say like, hey, who's the contractor? What's actually in this box? We'll get a report and we'll get an answer on that. And then should that be a second generation SCAR, then we'll just have them remove it and then use an alternative means. So.
Yeah, I think that's reasonable. I don't know that we need to necessarily go out and police this.
Yeah.
Yeah.
As long as they know and they have a list, so I think they're in the public buildings more than you would be, so they would
Right.
see a violation quickly.
Yeah, and should this pass, we would do outreach to all of the municipal departments, all the buildings, anybody who does any kind of like bidding processes and procurement, we would make sure that they know. So. And then I would say like, I guess the last thing, I would say maybe like we should leave this for the next meeting and then we can vote on it. But I would say just make sure to think of like an effective date that we want to maybe pass this. Maybe we do an effective date immediately and then we give like 2 months to comply or whatever it might be, right? So you can do like a later effective date or do an immediate and then give time for compliance.
Any more discussion from the board? Feel comfortable perhaps reviewing the information we have here and discussing it further at our next meeting?
Sounds good. Yeah. I'd like to
sounds
read
good
the
to
note
me.
from the state, because I hadn't read all of it.
Yeah, thanks for that. That's, I knew something was coming, but this sounds a little bit more comprehensive than just rodenticides.
Yes, so this second part, so the statement of support and the state bill go together. So the news is looks like on April 15th, the Mass Ready Act, there was a amendment. So Amendment 3, I believe it's on page, let's see. Okay, while I look for it, here, it's on page 1, 2, 3, 4. So I'm sorry, the double-sided, but on page 4 of 11. It's at the bottom of the page, bullet 3, protecting wildlife from unintended poisonings. So it creates a local option mechanism for towns and cities to choose to ban anticoagulant rodenticides. It talks about dangers of it, and it's Amendment 3. So essentially, this is the language where In the past, it was required to file a home rule petition by a city or town. They would have to be granted by the state to then restrict private property use. This addresses private property. They just passed Amendment 3, which allows cities and towns to do that without further approval. So, but this would still require a warrant, a town meeting vote, and then should it pass town meeting vote, then we could enforce it as a town on private property as well.
But this is something that would have to be brought to town meeting.
Correct.
Okay.
So this is what passed, and then but I think Bill 3050 also may address statewide bans. So there's a movement to ban this statewide. And in that case, that would make our jobs a little easier as a board. So this right here, the statement of support is a draft. It is essentially saying that the Board of Health would support a home rule petition should there be one at town meeting, basically in advance of town meeting, that would allow the town to restrict or prohibit the use of SCARs within Wakefield. This wouldn't have any like actual regulatory effect now, but this is just the Board of Health saying they would support a bill. So,
Yeah, that's,
or sorry, support a.
it kind of fits into where we're headed with this other policy proposal.
Yeah. So I would say, same thing, maybe this one, you may want to read over the press briefing, read over the statement. Please let me know if there's any changes you'd like to make to it. But otherwise, we could vote on it all next meeting, or any changes you might want to make, we can do that too.
And the vote, do we need to vote on the statement of support?
So as a board, if you want to endorse or make a statement of support for something, you would need a majority
We consider a vote on the statement of support for that amendment, and we would consider a vote on the policy.
Yes.
So 2 votes.
Yes, it'd be 2 separate votes. Yeah.
Great. Any other?
Any questions about the statement of support or the kind of state bill?
I personally think we're being poisoned left, right, and center, and not just wildlife, but our children through processed food. And like it's horrific that diabetes is an epidemic with young children in our country right now. So I am not necessarily opposed to taking poisons out of our environment and out of our toxins that we're exposed to constantly. Yeah,
Great.
Mm.
All right.
It's been something, this should have came about probably like 5 to 10 years ago when we really discovered how it was, affecting a lot of animal and wildlife. But it's a good thing, it finally came up.
Okay. Health Director?
Yes, so we have Melissa here as well, so I'll let her kind of dive a little bit into what she's been working on. But camp season has been busy, as you can imagine. But we are excited. Camps are almost here. Melissa and Sandy have been working hard at it. So yeah, and then Sandy's also been working on Medicare renewal, which is a beast. I know we just did that in Stoneham, and only took us 3 months. But Medicare is a difficult process for us to get renewed. So we just, it's every 5 years, I believe.
I think so, but part of the problem is the authorized signer was Steve, and Steve is gone, and there's a form that nobody can seem to identify. Sandy's been to the treasurer, she's been to accounting, she's been everywhere, and nobody
Knows where it is.
or what it is.
I was just gonna ask, what is it you're tasked with?
Oh, sorry. So
It's a validation.
yeah, revalidation for reimbursement when we do flu shots, when we do, so we have to have that in order to receive
Able to bill.
insurance billing for shots. So yeah, hopefully that gets rectified soon.
I'll find it. I think, I'll talk to you later. I think I saw it when I was in Melrose, a coffee somewhere, because I had questioned that where it was. I think I might know if I can remember.
Sounds good. Okay, and then food inspections, we are well underway. As usual, we've actually got really good reports recently. Yeah, we don't really have anything food related that's been an issue. And then pools. Pools have been a big one. It's close to Memorial Day. We are opening a lot of pools here. Shelby and our inspectors are working hard to get all pools inspected and ready to go so people can enjoy them by Memorial Day.
What kind of pools do we have in Wakefield?
So any public or semi-public pool. So I'm thinking like any apartment complex, like
Do you find that the new apartment complexes are not going with pools? I noticed because I looked at a lot of them when they were, when they've started here, and I noticed they don't, and I know that that was a big question.
The big one by the lake, do they have one?
The basin, you mean?
No, they don't.
I don't think they do. Yeah.
They don't. The other ones are not. They don't. The one that has it is the one there on behind us in Greenwood down by the railroad tracks. They have one on Renwick Road. I never even knew it was there till
Yes.
somebody went to it.
Yeah.
Somebody called. Yeah, there's one there, and then at our over there in Audubon Road.
Colonial Point, yep.
Yeah,
Oh, yeah.
yeah,
So they do have a pool. That one's a year-round pool.
yeah,
Oh, is it inside?
yeah.
It's inside, yeah.
It's inside.
Okay.
Yeah, we didn't try.
It's interesting because actually all of the I think almost all the new developments in Stoneham, all the larger ones, all have pools.
Pools, yeah.
Yeah, we only have 6, right? We have 6 in Wakefield or something.
Yeah.
Yeah. We have 6 pools in Wakefield, and
About 20.
we have 17. We have 17 of them in Stoneham, which is
You have a lot. It's
per capita is a lot of pools. Yeah, highest concentration of pools.
Interesting, yeah.
So this is what we always used to say. It's not like when you have an outdoor pool, even if you have one in your backyard, you can't use it all year, And
Yeah.
that's why, Audubon Road has the indoor, so they're lucky because they can. And I think the hotel got rid of theirs. They used to have it, the Dome, that used to be there, that's gone.
Used to be
The Hilton on 128 years ago when that
Oh.
first was here, they actually had out in the front, it was a pool. It had a big glass dome over it. If you ever get to see the old pictures, that's where their pool was. Yeah,
no idea.
yeah.
Oh.
Last year when we had the conference there, the girl was telling everybody and I said, yeah, I remember that. Time changes. I don't know, guess,
Melrose has some too, I think, right?
Yes, I believe so. Actually, Melrose only has 5 or 6,
You, just
6 pools.
you.
I think, yeah.
All right.
it's.
Okay.
And the last thing is, we are now approaching the warm season. Well, we're here in the warm season. So we are keeping an eye on the Lake Quannapowitt. We have yearly algae blooms. Lake Quannapowitt is not swimmable most of the year anyways, or any time of the year. Just to be clear, people should not be swimming in Lake Q at all. But should we see algae blooms in Lake Q, we will be reviewing that and then issuing a public health advisory, telling people to limit water activities. I know we have camps that actually use the lake for,
Boating.
recreational and boating.
It's really just the yacht club camp, right?
I think.
Yeah.
I don't think, because Camp Q is not at Q anymore. It's
No, it's adult.
Yes, that's correct. Yes. So I think they were the only other ones that were
But they never went in the lake.
not that I'm aware of.
They don't like. They
Uh,
went to the Y in Burbank.
So we would tell people to, be careful, try not to use the lake too much if they're exposed, rinse off.
Shut down that boat rental spot right near the gazebo when there's
I think that's
an
all.
advisory.
I think that's still open, but it's kind of advised risk that, should you fall in,
You fall in.
do something.
Okay.
And then they're cleaning up the lake or something with some kind of plants or something.
Oh, they're having
Sweet that-
a mustard weed pull.
Yeah,
Like
Oh, yes.
a community gathering.
that's nice. I'm glad to
Yeah.
see that.
Yeah.
My children learned how to swim in Lake Quannapowitt. But that was when Lake Quannapowitt was clean. It really wasn't. That's where they learned to swim. And it was a beautiful, beautiful area and a great place to go with your kids. It really was. But now I wish it could go back to that, but we'll never ever. I don't think so.
Yeah. But we have good partners and friends at Lake Q. They keep us informed.
Very happy. Very, very.
Speaking of contamination, I know there's been a lot of talk about new bathrooms at the ball field.
Oh, yes.
And that there was contamination in that space, and
Oh, okay.
there was some
Yeah.
reports that came to Board of Health.
Yeah, that was mentioned, you're right, in the article, the chair's name. Where they want to put it is actually where I think the old bathrooms were years ago. It was like
Perhaps,
only
yeah.
two, that little housing there. But I guess that there's some confusion over
Is
with
this
the
at
money.
Wakefield there?
That's Phil, yeah.
Yeah, and there was some contamination somewhere and nobody, I guess they really didn't have the whole report. It's in the item, I think it's tonight's item,
Oh, is
right?
that right?
I think it's
haven't
tonight.
read it.
No, last night's item.
I haven't read that
We're
either.
finally catching up. Yeah, the whole thing is in there and yeah, what about the money and what's it gonna do and what's it gonna cost? Because the only bathrooms were on the lake were the ones up here, Colonel Conley at the park, but they were only opened during the day. So they were never open like weekends or anything. They were private. Mostly it was for the people that went swimming there, did swimming lessons or used the lake. And then when they got rid of that, they closed everything down and nobody ever opened those up either.
Aren't there porta johns during farmers
Yeah.
markets?
Yeah.
There are, yeah.
And that's the big thing too. Do you just have them or do you have the ones now that you can buy that are like a trailer?
Mm.
And just like 4 or 5 of them, you can like rent them for weddings.
Oh, I know,
Yeah.
I know. you're talking.
Yeah.
A lot more cost efficient.
Yeah, because I guess there's a lot of, read the story. It's a lot about the piping and the everything else. I read it today.
Okay.
I'm a little bit behind. I'm sorry. I'm only a day behind. It's not bad.
Stop.
So I'm behind you, but.
Yeah. Yeah, it was an interesting article. It was very interesting.
Okay.
And then the last update I have is today was the annual town meeting, the annual celebration for Wake Up Coalition. They've been doing work. The kids showcased all the stuff they've been doing throughout the year, which was really cool to see. Also of note, the majority of the team are freshmen, which are really cool to see. They're stepping up. They're leaders already.
That means we get to kind of keep them for a couple more years.
They will likely stay with us throughout the 4 years. Really cool to see their growth over time, becoming leaders in the community. So we're excited to see that. We had great attendance. Senator Lewis, Rep Wong came. Senator Lewis actually received an award. He's stepping down from his post, but he has been a great supporter for many years. So he received a legacy award today. So we're excited to see, all the work that's been done. Andrew Sajoni from the schools came. We had tons of representation from, Melrose Wakefield Hospital and, all these great partners that come to all our meetings, but they came also to show support for the kids today. And so, yeah, just really cool to see and glad to see Wake Up still running strong after 13, 14 years now. So,
Yeah, they do a lot of important work.
yeah, Liz and Madhu did a great job keeping that going. So, any questions?
Did you have anything to add? Did you want to?
No, camps are just overwhelming. It takes a lot, especially with new camps, to get them to get up and running and to comply with all the state regs. Often, I know in Melrose, I have a number of camps and they don't even read the regs. They try to put their binder together without any clue as to policy or procedure. And so I really have to sit down with them and go almost page by page. It just, once they do it, the next year will be fine, but the first year is painful, mostly for me.
New ones in Wakefield?
I think Sandy has 3. She's got the little chronic palate, and they were marginal on their documentation last year, and Sandy brought them along. Now they've really put a lot of time and effort in, and I think they're doing much better. We're having a struggle with the Boys and Girls Club. They don't even have a healthcare consultant yet, which it's fairly late. So,
Starts in a month.
yes.
Mm.
So I saw an email today where their operations person had emailed, and they're also in Stoneham. So had emailed and said, gee, do you know anybody? We had counseled them since they didn't have one over a month ago. We said, look, you have to knock on doors. And if you know any nurse practitioners, any PAs, anybody, maybe that's the route that you'll have to go.
So an open call to anybody you might know or any friends who might want to serve as a camp counselor,
Yeah.
as a healthcare consultant this year. They usually pay. Most camps pay, I think.
Yeah.
Yeah.
So should you have any friends who are interested, let us know.
It's a good job I got a call and I sent it to Melissa from someone I know that runs a camp looking for a nurse. It's a really good thing too sometimes for even the school nurses that are off. Some school nurses don't work at all during the summer, but it's like only for a few weeks here and there.
Yeah.
Or a lot of night nurses or per diem nurses that can do it, or retired nurses, I heard. But the couple of retired nurses said no, full time.
Someone's putting their name in the hat. Okay. And the last thing I want to say is, Melissa, you and Sandy attended MAPHN conferences.
Yes, we did. And that was held out in Springfield this year, and there were a couple of interesting speakers. We had a very interesting discussion about vaccines and vaccine liability years ago, about diphtheria, tetanus, pertussis, about using whole cell pertussis, and how the vaccine has evolved over time. Um, so that's very good.
Maybe they'll bring the conference back to Wakefield at some point instead of going out to Springfield.
No, it's not. Oh, well.
It was hopeful. It was hopeful.
You were hopeful? Well, we did it. We did it for 2 years.
Yeah,
Past 2 years, and we did excellent conferences. And the best one was here when we had it right here in Wakefield.
Wishful thinking on my part. Feels a bit of a drive for us.
Right, yeah.
But otherwise, I think we're all set.
Just one little note. I know
Yes,
you
please do.
probably people don't know her, but there may be some people out there in the audience. A public health nurse who was here for many, many years and gave a lot of time here to the town of Wakefield, Pat Zangarelli, passed away this week. And she was a wonderful person. I don't think you ever got to meet her, but she worked here in Wakefield. She was our public health nurse for many, many years. And she also was an EMT, and she worked in Belmont, she worked in Needham, and young woman, raised her family here. They're still here. So we lost a really good public health person. She was a great person. She was a great mentor, and she was a great person to call. And she worked on the conference committee with me many, many years ago. I got to see her about a year ago. I saw her. We had a reunion. Every once in a while, we have a reunion. But she was a very nice, one of the probably most dedicated and devoted public health nurses we had here. She really was good.
It's too bad.
Mhm.
Sorry to hear that.
Okay, well, thank you.
Should we talk next?
Board, yeah.
Uh,
So, we are entering the summer months.
Thank you.
Figured I'd break that ice for you guys. Is there any interest in maybe a meeting or two where we take a break?
Yep. I would have interest in that. I don't speak for anybody else. But
And should anything come up in the meantime, we'll let you guys know, but
So I'm sorry, I missed what you.
oh, sorry, I was saying we could take a break from meetings like, a month or two.
usually,
Are you a couple consecutive months or
Yes,
like?
July and
Don't-
August.
Oh, I do. I remember that
Yeah.
I took consecutive months.
Yeah, just usually July and August because it's quiet. And then by August, she's ready for flu.
So we'll meet in June.
meet in June,
Yeah.
and then, of course, like Anthony said, if anything comes up, then we
Anything board required.
together.
Yeah, just come in to the
Okay.
meeting.
So June, are we thinking same third Wednesday usually?
17th.
17th?
17th, that's Bunker Hill Day.
Oh, is it? Oh, it is.
Yeah, but it isn't a holiday anymore, so they took it.
We could do, actually,
Would the 24th work? Would
Yeah,
that?
we can do the 17th. Schools are open. Nobody has it as a holiday anymore. I think they took it away from us.
Yeah, I
completely.
think you're correct.
I still like it. Just get her off from school.
we could also do the 10th if you guys are interested. I don't know if that's too soon, but I mean, that would give us time to
Think about this.
address the rodent thing.
I'd rather do the 17th. I won't be around the 10th. I know. Because I know. But want to do the 17th, keep it the way it
17th
is.
Works for
That
me.
way we'll do it, huh? Works, yeah.
So that works for me.
Okay.
6:30?
Yes.
6:30, yeah.
I'll make a motion to adjourn the meeting.
Second motion to adjourn,
All in favor?
Silver eye.
Macaulay, aye.
Hannah, I. So moved.
She hasn't beat my record yet. but-
Hold it.
Thank you, everybody.